Hi everyone, Dr. Jeff with you today. Today we're talking about golfers and tennis elbow. What's the difference? What are the causes of it? Tennis elbow is the top of your elbow here. That tendon runs in and actually attaches to the outside of your elbow here. The golfer's elbow, the tendon runs here, attaches to the medial elbow here. Similar causes as to what can cause these things. A lot of times it's improper mechanics, overuse, things like that. What you'll find with golf is that sometimes with the golf, if your grip is wrong, if the grip is too small, you have to grip too tight. If the shaft of the club is the wrong one for you, there's too much vibration coming through the club into your arms. That can cause the elbows to get sore. Same thing in tennis. If you have a tennis racket that new strings or too much vibration on the tennis racket, change your grip or grip size. That can cause a tennis elbow to come on. Bowling, if you change your bowling ball, things like this. Any kind of change, if you're changing something in a sport or mechanics, can cause the elbows to get sore. Usually starts off with a bit of a pain, a bit of an ache, and get to the point where I've had patients where they can't even hold their coffee cup anymore. They can't shift gears in their car, things like that. So it can get very, very painful and very debilitating. The way you treat tennis elbow or golfer's elbow is ice. Don't just throw an ice pack on it. You want to do ice massage. So the best way to take that is to get a water ball, put a little bit of water in the bottom of the water ball, freeze it up, take that water ball and actually rub it briskly in for 1 to 2 minutes into the area that's sore. Likewise out here if that's sore. You want to stretch it. So stretching is very simple stretches, stretching in, stretching out, rotating, things like that to stretch it out. If you want to do some strengthening exercises, I suggest all you do is get a soup can, nothing very heavy. You're just going to do simple exercises up and down the soup can this way here, up and down like that, just to get some strength back in the arm. Those are the best ways you can actually treat this at home. Also, look at the possible cause. If you need to change the grips on your clubs or get a golf lesson to make sure your mechanics are right to try and prevent it from coming on. Here at the Goldsworthy Wellness Center, we have something called shockwave therapy. It's like a hyper-intense ultrasound. It's a newer technology that goes in and actually, they've really found a high success rate in treating golfer's elbow and tennis elbow. It takes about 5 treatments or so. It goes in and regenerates the tissue. We'll also do something called active release therapy, which is a massage technique that will go in and realign the fibers and get the strength back in the arm. So if you know anybody that's suffering from some golfer's elbow or tennis elbow or some tendinitis, we can certainly help them here at the Goldsworthy Wellness Center. I'm Dr. Jeff. I've got your back.